So one of the biggest problems in healthcare is the fact that patients don't understand the healthcare dollar that's invested in their clinical appointments. Even before the appointment, there's a lot of time invested by your administrators to make sure the patient is showing up to the right appointment and seeing the right doctor. Because the patients are not paying for their appointment out of their own pocket, they don't understand how much is invested ahead of time, as well as how much our government or how much insurance companies invest in reserving that spot for them. This leads to really high no-show rates, often in the clinical environment. In an outpatient setting, the no-show rate can range between 20 to even 50% of the time. Whereas in our clinic, our no-show rates hovers between 4 and 8%. And that's because we have a lot of automated processes built in to notifying patients ahead of time when their appointment is, reminding them as it gets closer to the appointment date, and then making sure that everything that they need to get done ahead of time is done so that their encounter goes smoothly and that they can move on to the next treatment step. Another problem that we experience in the clinical environment is often patients don't really understand what is happening to them. Often what happens is there's a lot of medical jargon being utilized during the clinical environment, as well as sometimes patients are shocked because of the diagnosis that they're receiving. This all prevents the patient from really understanding what their diagnosis is and what the medical plan is going forward. What's great about what we're doing at Skinopathy is that we're integrating both what the physician-facing side of information as well as the patient-facing side. Skinopathy OS is where doctors are recording their clinical encounters, and it's integrated in with the patient portal, which is called Get Skin Help in our clinic. It allows us to do is release patient information about their clinical encounter after the encounter has happened. AI takes the clinical encounter and summarizes it in the OS, and then pushes that information over to the patient side. This allows them to understand in a more wholesome way their diagnoses and how to manage their condition with time.